Good morning, everybody. How are you all doing? Hope you're doing well on this Tuesday. And in the Midwest, I hope you're not getting too much snow out here in the Northwest. It's actually sunshiny. And I have kind of a scratchy throat. Staying in hotel rooms, the air is so dry, and I've been talking a lot because of my job, and I think I'm kind of losing my voice today. And I'm talking to you, so hopefully you guys can put up with me. But I wanted to jump on here today as normal and talk to you about the other way that our moods can affect our health. And the topic for today is talking about self-care. And as far as self-care goes, we've heard that term before. It's something that's bandied about all the time, and it's something that people use and maybe not understand. The other term that is used a lot is called listen to your body. And what does that really mean, though? So listen to your body is usually focused in on those people who are exercising and working out and pushing themselves physically. So listening to your body means that it's okay to be sore. It's okay to be tired. It's not okay to be exhausted and feel ill. And it's not okay to have pain or pinching when you're working out. So when you're talking about exercising and self-care and listening to your body, that's what they're mentioning. That's what they're talking about. Soreness is okay. A little bit of muscle fatigue while you're lifting weights, that is okay. But if you have pinching or pulling or pain or exhaustion, those are not okay. So listen to your body, self-care. What does these have to do with moods? Well, I'm going to get to that in just a second, but I want to talk to you about what self-care is. So self-care started in the medical and mental health field a long time ago, talking about how clinicians and practitioners need to take care of themselves because they're giving so much of themselves to other people to help them feel better, help them feel well. And so you would have a lot of people, social workers, counselors, doctors, nurses, get burnt out. And they would actually do more harm, not only just to themselves, but harm to the people that they were trying to help. And so this self-care phenomenon came out. And then, of course, it developed and blossomed into everybody needing self-care and this practice that everybody needs me time. And so I have my own philosophy on me time. I think it's beneficial for us to take care of ourselves, but I think there is a balance between selfishness and time that you use away from people that are in your life and caring for yourself. So I'm going to talk about healthy self-care here and using that time to kind of hit the reboot button on your life and your moods. So self-care is I'm focusing on it with the mental health aspect and our moods. Since I'm a counselor, that's where that's my wheelhouse, right? So that's what I'm going to be focusing on. When we push ourselves too much, when we don't take a break, when we have late nights, when we have a lot of stress at work or in our relationships, or maybe we're caring for a loved one, if we extend ourselves too far out, then there's nothing left for us, and we don't have time to kind of recenter ourselves. So if you caught yesterday's video, I was talking about sleep, and the most important part of the circadian rhythm is REM sleep, rapid eye movement cycle or stage. And in that moment, that's when we're dreaming. And when we dream, it's when we kind of solve our problems. It's when we process through all of the day's events. So you can do that same thing in self-care strategies, and you'll be awake while doing it. So we need that moment that you can call it daydreaming if you want, but you need that moment during the day when you're awake to process through all the things, all the factors, all of these stressors that are aiming at you, that are coming towards you, that do not stop. All these stimulants that are coming at you. So we have stimulants from work, our email, our bosses, our coworkers, our clients. We have them from our family, doctor's appointments, feeling ill, sick parents, sick kids. We have it from our groups that we're in, people asking us to do extra things, from our community partnerships that we're involved in, whether it's church or leagues or mentoring groups that we're part of. Everybody's asking us to do more and more and more. So we don't have to be the Energizer Bunny, right? We have to have those time to take care of ourselves. So if you just go to the dictionary and look up what is self-care, it's caring for yourself without professional or medical assistance or consultation. So the idea here is that you can do it on your own. You can do it in a quick moment. You can do it any time of the day. So it can take on so many different forms, right? It can be short or long. It can be really expensive, or it can be free. It can be structured or unstructured. It can be formal or informal. It can be informal. So what are some of those ideas of self-care? Well, the standards are getting a massage or a pedicure, a manicure, a facial, going for a walk, right? Some people consider exercise to be self-care. Again, keeping in mind that we are focusing on that it needs to be restorative, not punitive for ourselves. So keeping that in mind. Naps are certainly a way of self-care, but making sure they're that it is restorative again. Journaling, meditation, prayer, talking with other people that you find restorative, that you find are beneficial for you and not stress-inducing. Coloring books. I'll tell you what, this kick of adult coloring books, I don't know where it came from, how it started, but I thought it was really goofy at first, but I've done it, and I'm actually working with somebody right now that uses them all the time, and it's actually kind of fun. It's not something that I'm going to go to on a regular basis, but it's actually kind of fun. Crossword puzzles, anything like that, journaling. So, and then this mindfulness practices. This is another practice. It's been a therapeutic practice out there for a very long time. And mindfulness practices has been taking off more and more because people are learning how to use mindfulness practices without that professional consultation, without going to therapy for it. And so you can just Google mindfulness practices and you can find some. But I would recommend that you find a reputable source. And if you need a reputable source, you can come to me. I'm certainly one of those places. Or if you are involved in some kind of therapy, then you can reach out to your therapist or your counselor there and ask them if they know about mindfulness practices. But here's the important thing, is that self-care, whatever version it takes for you, it affects our moods, and which in turn affects our nutrition. So if we are so stressed out, if we're acting like the Energizer Bunny, then we're not going to be our full selves. We're not going to be running at full capacity. We're not going to be able to focus. We're not going to be able to strategize or process through life's events. So again, as I said, that REM sleep where we can process through and we can sort through all of those troubles. Sometimes we even wake up with our problem solved because we did it in our sleep. The same thing needs to happen during the daytime. So scheduling yourself to heal our mind so that we can heal our moods. Stressing out, being overwhelmed, being distracted, being frustrated, right, from lack of sleep or from that stress and multiple stimulants that do not stop, raises our cortisol levels, right? And high lasting stress levels and cortisol levels actually adds weight to us, right? So it's like that inner tube around your belly, and that fat that is around your belly is the most unhealthy fat that you can have for yourself. So taking care of yourself, and I'm not talking about just physically, but taking care of yourself mentally is going to be super important to your health and to your moods. Because if we are not taking care of ourselves, our moods are poor, and so then we don't have the strength or the mental ability to make good decisions on our nutrition and our fitness. So if our mind is right, our body's going to be tight, okay? So get your mind right and your body will be tight. So here's some tips. Just schedule yourself, right? We schedule doctor's appointments for our kids. We schedule work meetings. We schedule phone calls, things like that. But schedule for yourself. 15 minutes. That's all you need to start with. And if 15 minutes is too much, start with 10. But schedule yourself. But don't do it at bedtime, right? Don't do it at bedtime, because what's going to end up happening is you're going to say, oh, I'm just going to lay in bed and I'm going to do some meditation, or I'm going to pray. I'll tell you what, when I try to pray, when I'm in bed and it's all time for me to go to sleep, I end up falling asleep. Well, how was that benefiting me? I didn't get a chance to actually get the full benefit of that self-care, of sorting through those things. So you want that daytime ability of self-care different from the REM sleep that you're getting during the nighttime. So just don't do it when you're falling asleep. And then pick a couple activities that interest you. So if you want to give that adult coloring book a try, grab one. They're at the dollar store. Come on, just grab something. You can even buy a kid's coloring book. It doesn't even have to be the adult coloring books. Get anything. Get a journal. Go for a walk. Schedule a phone call with your best friend or your grandma. On a regular basis, so that you can have just that time where you can just relax and decompress. If you don't like the ones that you try, it's okay. There's so many of the ones out there. If you don't have the money to spend on a massage every week, that's okay. There's self-massaging devices out there. Just go pick them up at TJ Maxx. That's where I've gotten mine. This curved shepherd's hook looking thing that has a knobby end, and I use it to massage my back, and that's perfect, right? You're doing self-care. You're massaging yourself. You're being mindful. You're being present in the moment while you are treating yourself. So pick a couple, try them out. If you don't like them, move on to the next ones, but find those few that you can do on a regular basis. Here's the other thing. Involve your family and your friends. So I'm not talking about pairing up to do activities. I'm talking about and getting them involved to say that, hey, I need this space. I need this time for me. And so if you can give me just 10, 15 minutes of uninterrupted time, then I'm going to be back. I'm going to be full-fledged me and ready to go. So ask them, right? Get their involvement. Get their okay, get their willingness to help you out in this area, because the more mentally healthy and stable and mood stable and happy you are, the better you're going to be working with your coworkers, with your family and your friends. Next, give it a full 7 days of trying it. One day is not going to be enough. You might find some experience that it goes really well, but to truly get the full effect of self-care, you need to do it for 5 to 7 days. So really dedicate yourself to it. Set aside that time, schedule it in your calendar, and go for it. Hey, listen, if any of this has hit home for you, if self-care has been an area that you struggled with, or you just don't find that it benefits you, hit me up. Let's chat about that, because I've got so many strategies. I've got tips and tricks. I've got those things that can help you. I am here to help you be a better version of you. That's it for today. So I hope that you guys enjoyed these videos. Stay tuned for the rest of the week. We're going to be talking more about how our moods affect our health. I'll catch you then. Have a great day.